What if modern plastic surgery was influenced by a procedure performed in an Indian village in 1794? Can you imagine that possibility? To understand how this happened, we must travel back to India in the year 1794, shortly after the Third Anglo-Mysore War had ended. Among the many ordinary people caught in that conflict was a man named Kawasjee, a bullock-cart driver who transported supplies for the British forces. During the chaos that followed the war, Kawasjee was captured by forces opposing the British, and as punishment, his nose was cut off, a form of public humiliation practiced in parts of India at that time. In the 18th century, losing one's nose was not only a physical injury, it was a visible mark of humiliation that could follow a person for the rest of his life. British surgeons who were present in the region offered to treat Kawasjee using the surgical knowledge available to them. But Kawasjee refused their help and made an unexpected request. He asked to be taken to a local Indian surgeon instead. Why would he do that? The surgeon he requested was not trained in a European institution. He belonged to a potter community near Pune and practiced surgery as a hereditary tradition. Was this an act of desperation, or was it faith in a knowledge the British had never learned? Despite their doubts, the British officers agreed and allowed Kawasjee to be treated by the village surgeon. The village surgeon examined the wound with steady focus and began preparing for reconstruction. Instead of guessing, the surgeon shaped a simple leaf into the form of a nose and used it to measure exactly what was required. Then he traced that same outline on Kawasjee's forehead, marking the very skin that would become his new nose. Then came the most critical step. The surgeon cut a flap of skin from the forehead, but he left it attached between his eyebrows so that blood could continue to nourish the living tissue. With steady hands, he rotated the living flap downward and stitched it in place where the nose had once been. There were no antibiotics, there was no modern anesthesia. Yet because the blood supply was preserved, the living tissue had a chance to survive. Over time, the new nose survived. The tissue healed, blended into his face, and restored both function and dignity. Two British surgeons, Thomas Crusoe and James Findlay, witnessed the operation and carefully documented every detail. Their report was published in London in 1794 in the Gentleman's Magazine, introducing Europe to a reconstructive technique it had never practiced in this form. Years later, in 1814, Joseph Constantine Carpew studied this Indian method and successfully performed the same procedure in London. But the knowledge itself was far older. Nearly 2,500 years earlier, Sushruta had described rhinoplasty in the Sushruta Samhita, detailing surgical instruments, wound care, and precise measurement methods. The physician Sushruta described surgical instruments, wound care, and precise measurement techniques, knowledge that would survive across generations.
The operation performed on Cowasjee in 1794 was not an accident. It was not a sudden invention. It was the continuation of a surgical tradition that had survived across generations. A village surgeon restored one man's dignity. Sometimes history does not shout its achievements. It simply survives quietly until the world is ready to notice. If you believe such stories deserve to be remembered, consider sharing your thoughts in the comments section and sharing this video with someone who values truth in history. Because history is not just about what happened. It is about what we choose to remember. And do remember to subscribe.